Okay, so today I'm going to talk about Prozac. The generic name for Prozac is fluoxetine. Generally speaking, there have been no issues with the generic, and taking fluoxetine is fine. Originally, it was available in capsules, but I think now also can get tablets. I generally still prescribe the capsules. Dose range for Prozac. Oh, actually, before I get into that, so Prozac is, it was the first SSRI, selective serotonin reuptake inhibitor, and pretty much revolutionized psychiatry, some for the good, with one thing I wonder may be a bit of a disadvantage. But the main advantage over the previous class of antidepressants, and that's mainly what Prozac is used to treat, although it can also be used for various kinds of anxiety disorders, but mainly it's an antidepressant. But that term is often misleading in psychiatry. But anyway, trying to stick with Prozac. It's mostly used to treat depression, what we call unipolar depression. It should not be used for people who have depression but have bipolar disorder, because it can trigger so-called manic or hypomanic episodes, which is what we certainly don't want to do. So it's mainly used to treat unipolar depression and a variety of anxiety disorders. And it's usually dosed starting at 20 milligrams. And generally up to 60, although you can go higher if it patients on 100 milligrams, maybe even more. But that's a very individual thing. So generally in the 20 to 60 milligram range. And this is the key. And this is the thing that is often overlooked. And I understand why it's overlooked. But for Prozac and most of the antidepressants in the SSRI class, well, all of them in the SSRI class and the related SNRI class, they must be taken for about 2 months before you can say for sure whether they're going to work or not work. Now, often people will notice benefit before that 2-month period, but a lot of times people take them for even just a week, and then they don't feel any different, and they stop them, and they decide that Prozac doesn't work. And I think that's creating a lot of misunderstanding and a lot of what we could say is false failures of treatment. So very important is that these medications, they just have to be taken for at the minimum 8 weeks, maybe as long as 10 weeks. But I just use 2 months as a rule of thumb. And that's really the first challenge in treatment, is just getting people to understand that we don't know exactly why the mechanism takes so long, but it truly does. I have had many, many patients say they didn't feel any different, any benefit, through the first 6-7 weeks. And then as they get towards that 2-month marker, lo and behold, something changes. So that's the most important thing, and like I said, I think leads to a lot of misunderstanding. So, as I mentioned, it's used to treat a variety of anxiety disorders, and that's true of most of the medications that are called antidepressants. The vast majority, not all, but the vast majority are also very effective and often FDA approved to treat panic disorder, generalized anxiety, even OCD, the whole host of anxiety disorders. Now, this is a point that I wanted to make very clear about Prozac, is that the process of coming off. So one unique thing about Prozac is that it has a very, very long half-life. It and its metabolites have a very long half-life. What that means is it takes quite some time for the Prozac to come out of your system. But the good side of that is that it's virtually impossible to have withdrawal symptoms from Prozac. It's essentially the dose is going to reduce in your system so gradually that you're not going to get withdrawal. And this is one of the things that I hear I read online that drives me crazy, where people complain about a wildly, severe withdrawal phenomenon. I never say never. There certainly could be individuals that may have had some kind of difficulty as they stop Prozac, but it's really unlikely. And we actually use Prozac to substitute for other SSRIs that have shorter half-lives that people are having trouble coming off of. We'll swap them onto Prozac and use Prozac to get people off of medication because it has such a long half-life and pretty much universally does not have any withdrawal. In terms of anything special about Prozac, this long half-life is one thing, and any common side effects, and this is true of most, I keep saying most, all the medications in this class and similar classes, is that they can have sexual side effects. Up to a third of people can have things like reduced libido, problems with orgasm, delayed orgasm. But the thing I like to point out when prescribing the medication is that 1/3 of people having it is quite common. There's no doubt about it. But it also means that twice as many people don't have the sexual side effects. So if you have 1/3 that do, that means that you have 2/3 that don't. So twice as many people don't have the side effects. So and they're completely reversible. So if you develop the side effects and they don't go away, as you come off the medication, the side effects will get better and be alleviated. So that's the general kind of information about prescribing Prozac. It's even though it's the first medication of its kind out there, I still prescribe it a lot. It has a lot of advantages and still in common use and available as generic, fairly inexpensive. So I think an excellent part of our options for individuals with depression and anxiety. Okay, thanks.